We encountered so many PPH cases in this hospital. Some of them, they used to come after delivery, and some they used to develop PPH in the hospital. Despite all the oxytocin drugs we administer to the patients, oxytocin 10 international units, it won't work. You have to give 40 international units in a liter of IV fluid. They will still bleed after all these interventions.
Gado in kwanta ba gado, ni na dawo ƙasa, a nan dai na kwanta, shine jini yayi ta zuba, yana ta malala. 'Yan uwana da suka zo ana saka yana zuba. To dai a nan wajen ne na kwanta, a kusan 12 rana, sai wajen ƙarfe 6 na yamma, a wajen 12 ina nan.
The Smiles for Mothers program seeks to reduce maternal deaths due to postpartum hemorrhage. We're working with 3 state governments in Nigeria, Lagos, Kano, and Niger, as well as collaborating with the Federal Ministry of Health to implement innovations across the 3 states to reduce postpartum hemorrhage. It's very consequential, especially in our setting in low middle income countries, because included a new entrant, a new drug into the uterotonic mix. That is heat-stable formulation of carbetocin, an oxytocin analog, but was also found in trials, for example, the Champion trial, to have very similar efficacy with oxytocin in preventing postpartum hemorrhage.
Champion's trial is a clinical trial organized by WHO, the largest clinical trial on postpartum hemorrhage. About 30,000 women. Champion's trial looks into alternatives or drugs that are very effective and comparable to the standard care, testing whether heat-stable carbetocin is not inferior to the standard care, which is oxytocin. It was conducted in 10 countries using 23 centers, in which Nigeria was lucky to be part of those 10 countries, and we had 2 centers, Mother and Child Hospital, Akure in Nigeria, and the University College Hospital in Ibadan. The standard care, which is the oxytocin, require a cold chain from manufacturer to the end user. By transporting it, it must be in a cool van and maintaining a temperature of 2 to 8 degrees centigrade. This is not usually available because most of our deliveries are either in remote hospitals or areas where we cannot maintain constant electricity to keep those drugs at that temperature. That is the advantage heat-stable carbetocin had over the standard care.
One major challenge faced in Nigeria is the issue of power. There are some times that we even go weeks without light. Other uterotonics, the condition for their storage, it requires light. And it's a major challenge. HSC is a very big breakthrough in the field of medicine, in particular with the uterotonics. Other uterotonics needs a very good storage condition, cold chain for their storage. And without power, you cannot achieve that. But now, with the coming of this HSC, we can store them on our shelves and it's easily accessible for our patients. This is on our shelf, but you can't find any uterotonics on this shelf. So I must say it's a big plus.
We believe the heat-stable carbetocin will give a better result, because you will be sure of the quality you are giving to the pregnant mothers as far as prematernal and child health care intervention is concerned in the state. So we are really happy with this introduction of this new molecule.
We're undertaking series of trainings with health workers so that first of all, they are reacquainted with the acute management of third stage of labor more broadly, but then also understand the implications of having new options for uterotonics. Secondly is about the supplies. We also worked with IDA Foundation, Ferring Pharmaceuticals representative in Nigeria, to work through getting approval to import the drugs, clearing the drugs, and actually delivering them to the state medical stores.
What we wanted to do as a Small Cell Mothers program was to support the state to adopt the updated WHO recommendations for uterotonics use, including heat-stable carbetocin in the country. Update the normative policy documents, so the essential medicines list, the life-saving skills manuals to include carbetocin. And then the next step following that was then to have carbetocin being used in the facilities. One of the things that we're initially able to do at the get-go was train 241 healthcare workers, so doctors, nurses, across the state-owned facilities, primary, secondary, tertiary. So we're able to do trainings on emergency obstetric and newborn care, but we specifically also wanted to focus on active management of third stage of labor, including PPH prevention and management. We've been able to support appropriate utilization of uterotonics, including HSC, in all 6 facilities. We've seen heat-stable carbetocin being used across all 6.
To make sure the financing to keep it coming is sustainable. We worked with Ferring to donate a seed stock of the doses, which was also very excellent in terms of their contribution to helping Nigeria reduce maternal mortality. We got over 69,000 doses as seed stock and been distributed between Lagos, Kano, and Niger states.
Heat-stable carbetocin as a uterotonics agent has a very good effect on the uterus. We have a minimal bleeding compared to when we are using oxytocin.
Ina samun matsala sosai na bayan haihuwa idan na haihu na zubar jini. Da na haihu kafin a haihu ita ce akwai allurar da za ta yi mani idan Allah ya yarda ba za a yi wannan zubar jini ba. Shikenan bayan na haihu ina haihuwa sai suka yi min wannan allura ita maman baby. Dukansu kowace na samu matsala wannan haihuwa ta zubar jini amma ban da wannan guda ɗayan nan.
Having an oxytocin that is actually heat stable, which means we don't need a refrigerator. We can keep it close to the patient when she's going to deliver, and then we can quickly administer it within a minute of delivery so that we can save this woman from dying from postpartum hemorrhage. There is the need that we make heat-stable carbetocin available to the women in low-middle income countries.
I have high hope that this heat-stable carbetocin will really prevent PPH and at the end reduce maternal mortality in our country and in the world at large.